Hip pain in young patients can have various causes, ranging from overuse injuries to underlying medical conditions. A proper diagnosis is essential to determining the specific cause and appropriate treatment. Here are some common causes of hip pain in young individuals and potential treatments. 1. Overuse or strain. Cause. Activities like running, jumping, or participating in sports can lead to overuse or strain injuries. These may include muscle strains, tendinitis, or bursitis. Treatment. Rest, ice, compression, and elevation, RICE, can help alleviate symptoms. Physical therapy may be recommended to strengthen muscles and improve flexibility. Non-steroidal anti-inflammatory drugs, NSAIDs, can provide pain relief. 2. Hip labral tear. Cause. A labral tear is a tear in the cartilage that lines the hip joint. It can result from trauma, repetitive motions, or structural abnormalities. Treatment. Conservative treatment may include physical therapy and pain management. In some cases, arthroscopic surgery may be necessary to repair or remove the torn labrum. 3. Femoroacetabular impingement, FAI. Cause. FAI occurs when there is abnormal contact between the ball and socket of the hip joint. It can be a congenital condition or develop over time. Treatment. Conservative management may involve physical therapy and NSAIDs. Severe cases may require arthroscopic surgery to reshape the hip joint. 4. Hip dysplasia. Cause. Hip dysplasia is a developmental condition where the hip joint doesn't develop correctly. It can lead to pain and instability. Treatment. In infants, harnesses or braces may be used to correct the hip's positioning. In older children and adults, surgical interventions like hip osteotomies may be necessary. 5. Stress fractures. Cause. Repetitive stress on the hip can lead to stress fractures, especially in athletes. Treatment. Rest is crucial for healing stress fractures. Crutches or bracing may be necessary to reduce weight bearing. Physical therapy may aid in recovery. 6. Inflammatory conditions. Cause. Conditions like juvenile idiopathic arthritis or ankylosing spondylitis can cause hip pain in young patients. Treatment. Treatment typically involves anti-inflammatory medications, disease-modifying drugs, and physical therapy to manage the underlying condition and alleviate hip pain. 7. Perthes disease. Cause. Perthes disease is a childhood hip disorder where the blood supply to the femoral head is temporarily disrupted, leading to bone death. Treatment. Treatment may involve bracing or casting to maintain hip position. In some cases, surgery may be required to reshape the femoral head. 8. Trauma or fractures. Cause. Direct trauma or accidents can result in hip fractures or dislocations. Treatment. Immediate medical attention is necessary. Treatment may involve casting, surgery, or joint reduction, depending on the severity of the injury. Proper diagnosis by a healthcare professional, often involving imaging studies such as X-rays or MRI scans, is crucial to determining the underlying cause of hip pain. Treatment plans should be tailored to the specific diagnosis and the patient's age and activity level. In some cases, surgical interventions may be necessary to address structural issues or severe injuries, while others may respond well to conservative approaches like rest, physical therapy, and medication. Early intervention and a comprehensive treatment plan can help young patients manage hip pain effectively and maintain their long-term hip joint health.